Angela Alsobrooks. This morning, the county executive will be bringing remarks to let us know what our incremental modified phase one will look like for Prince George's County. She will also be making announcements in regards to the task force that will help our county move forward. So first you'll hear from County Executive Alsobrooks, followed by our Chief Health Officer, Dr. Ernest Carter. Then we will hear from Dr. Charlene Dukes, President of Prince George's Community College, followed by Bill Von Haney, who is a Senior Vice President and Chief Strategy Officer for Exelon.
Good morning, everyone. I first want to thank you all for being here this morning. And before I begin anything, we are here this morning. Dr. Carter is with us. We're going to hear from him just in a moment. But I do want to extend to him a very personal, to offer our condolences to him. He lost his beautiful mother this past week, and in spite of his own loss, he has continued to push for us. So we continue to be amazed by his leadership. I want to thank him, thank his entire team at the health department for the just magnificent leadership they have shown and commitment to all of us, as well as all of our employees throughout the government who have just been phenomenal. And so I want to thank them for continuing to work so hard for all Prince Georgians. This morning I am especially delighted as well to have Dr. Charlene Dukes, who is president of our community college, Prince George's County Community College, and who is also, we are also joined by Mr. William Von Haney, who is the Senior Executive Vice President and Chief Strategy Officer for Exelon Corporation. They are with us, and you will hear from them a little later this morning regarding their leadership over the task force that we have stood up, and I want to thank them for being here. We're just so excited for them to lead this for us. Today we have 14,627 cases, as well as 478 deaths as a result of COVID-19 in Prince George's County. And as I have said over and over again, what that represents for us is almost the unthinkable, that we have had 14,000 plus of our residents who have become ill and who have suffered, as well as nearly 500 families who have had to grieve the loss of a loved one as a result of COVID-19. And so you've heard me say many times, and we continue to say how personal this is for us, and we continue to offer our thoughts and prayers to those who are grieving losses, and to say that we're all in this together. The last few months have been simply unbelievable. The hardships have been so great. The pandemic in so many ways really does hide the hardship, but they are there. One after the other. Many have felt isolated. This has just been a really tough time. And so what it reminds us of is that we are so grateful for the discipline and sacrifices of Prince Georgians who have had to make those sacrifices so that we could save the lives of those that we love and care about. And I am just so grateful for the actions that Prince Georgians have taken to make sure that they have adhered to the advice that we've received from the medical community, telling us to social distance, asking us to cover our faces when we go into public spaces, asking us to stay home when we wanted to come out. So this has been a tough time, but I am really grateful, and I want to say that Prince Georgians have done a great job of adhering to that advice. And because of their sacrifices, I believe that we will soon be able to move out of the shade of this pandemic, and that we will continue to find ourselves in the familiar warmth and care that our county is famous for. But you know what? I want to remind us also that we must continue to be vigilant. The truth is, and I know that Dr. Carter will tell you this, is that the coronavirus will be with us for a while. COVID-19 is still very present in our community, and so we should be mindful that we have to still be careful, cautious, and vigilant. This is not yet over. We are doing everything in our power to stop the spread of this virus in our community. We're doing everything in our power to keep all of you safe. And because of your discipline and because of some of the decisions we were able to make, I believe that starting June 1st, our county is now prepared to take the first step forward. You heard me talk about the executive order that Governor Hogan established, and that he laid out his roadmap to recovery. And during that roadmap to recovery, he talked about 4 pillars: expanded testing, improved contact tracing, increased supply of personal protective equipment, and hospital surge capacity. I told you that those would be the areas that we would be working on, and sadly had to say a couple of weeks ago that we were not quite ready. I believe that we have taken really substantial steps toward being more ready now to open, to begin some incremental and very cautious opening on June 1st. And the reason that we believe that we are more ready now is because when we talked about additional testing, and the testing is so critically important for us, we wanted to make sure that we could not only test those who were symptomatic, but we also have to have the capacity to begin to test some who are asymptomatic as well, because by the time we test symptomatic individuals, they may have had the opportunity to expose so many to the virus. But we'll begin now. As of June 1st, we are now opening an additional site to test in Chillum. We will continue to test individuals at our Cheverly site. We will also be opening additional sites on June 8th and June 15th. And we believe with the combination of state, local, and private testing, we will now have the capacity to test up to 9,000 individuals at a bare minimum each week. Dr. Carter and all of the healthcare professionals tell us that we need to be able to test at least 1% of our entire population per week. And we believe that now, as a result of all of the combined efforts, we are now able to test that number of 9,000 tests per week. We are also increasing our capacity for contact tracing. We currently have 50 contact tracers, but beginning next week, we will train, and I've told you about this, we're doing some cross-training of our county employees. We've also secured a number of contract employees, as well as volunteers who will be doing the contact tracing, so that we are comfortable that by the end of next week, we will have the ability to have 150 contact tracers working to contact trace. Our surge plan was also effective. We've identified resources for health workers and additional hospital capacity for our residents. We have monitored very closely the amount of med-surg bedding. We've also made sure to really monitor ICU beds to make sure that we have the capacity to care for those who are sick. As I told you, Prince George's County has been hit particularly hard by this virus, which means that unfortunately when Prince Georgians become ill, they become very, very ill. And so we've had really a lot of concerns around ICU capacity. What we know now is that we now have the ability to have free about 40% of our ICU bed space. Means utilization in the ICU is now down. It was at one point, utilization was up near 80%. We are pleased to see it start coming down, although it is still very high, at about 60% utilization. So we're now more comfortable that we have further ICU capacity left. With our PPE, we've been able to secure additional gowns, gloves, and masks for our immediate testing needs through the National Strategic Stockpile. I want to thank Governor Hogan and the state who did send to us 160,000 isolation gowns last week, and that includes an additional 40,000 that went directly to Doctors Hospital. We've now begun the distribution process for the remaining gowns, but we are comfortable that we have now been able to secure the amount of gowns that we need. We're working also to secure additional masks and gloves and other items that we're expecting to continue to come in to make sure that we are able to care for those who are on the front line, our healthcare workers, essential workers, and others who may be exposed to COVID-19 but for those supplies. All of the other groups, facilities, and businesses will receive PPE as it is available to us, and we need to be very transparent about the fact that all of these resources are not in an abundance. So we will follow the CDC guidelines in terms of how we distribute those items, beginning with hospitals, nursing homes. We have a whole list that we will have to adhere to as we distribute PPE. It will be, of course, according to how much we have and receive, but we will follow the CDC guidelines in terms of how we distribute those items. This is all to say that Prince George's County has the resources in place that we need to take the first step toward a phase 1 opening. I can tell you that we have not made this decision lightly. You know me, so you know that this is the case, is that we care deeply for the people who are here, and we decided very early on that we would take our advice from scientists and health professionals who would tell us when it was safe to reopen our community in a gradual and incremental way. We have followed their advice, and we told you that there were certain declines that we needed to see over a 2-week period, And I'm very pleased to tell you that Dr. Carter tells us, and he is a very cautious man, that we are starting to see some of those declines. Although our numbers and cases are still too high, we began the week of April 26th, for example, we saw 2,370 new cases. During the week of May 10th, we saw a 13.5% decrease in our total number of cases from the prior weeks, and our numbers continue to decline. The rate of death from COVID-19 is also going down, again, although it is still way too high. What we can tell you is that 3 weeks ago, over 70 residents per week were dying. The rate of death has continued to drop, and we are now seeing approximately 60 deaths per week. The loss of life from this virus has been terrible, and it is still a great concern for all of us. I am grateful that we are seeing some declines, but we must continue, again, to be vigilant because 60 is still too many. So coronavirus is still with us, and we are asking people to still be mindful that we still have coronavirus present in our community. We have also seen our bed usage decline from a high of 192 on May 9th, and last week we averaged 64 beds in use, down from 68 the week before. So we are seeing incremental declines. They are continuous, and as we've said along, as we approach reopening, we will continue to accept the advice from our medical professionals, and we will make decisions based on what they tell us. I am now comfortable that it is time to lift the stay-at-home order, although, again, I want to be very clear that we urge all those, especially those who suffer with the underlying chronic health conditions, to be very careful, and we ask those individuals to be careful and to stay home as much as possible. But in this new incremental and modified phase one, we will reopen retail stores with curbside pickup only. This means that you can order something online or by phone and go to the store to pick it up, and that it should be brought to you, that item, by a store employee. Manufacturing will also reopen with appropriate social distancing, use of PPE, and following CDC guidelines on cleaning high contact surfaces, and all employees must be trained on CDC COVID-19 guidance before returning to work. Barbershops and hair salons will be allowed to open for hair services by appointment only, with one customer per 200 square feet, and use of PPE. This includes face masks, gloves for all employees, and customers must also wear masks along with appropriate floor markings to create adequate social distancing. Employees will not be permitted to have clients waiting in a sitting area in the salons. All CDC guidelines for cleaning high-use surfaces must also be adhered to. Restaurants may open with outside seating only, and there can be no more than 6 people seated at a table. Tables must be at least 6 feet apart, and no more than 50 people will be allowed at any outdoor restaurant establishment, regardless of space. Employees, again, must receive health screenings prior to their shifts, and all CDC guidelines must be adhered to. Additionally, all employees must wear face coverings, and restaurants must have sanitizer, hand sanitizer, and appropriate hand washing facilities available. There will soon be a concierge portal available, and this concierge portal will allow restaurant owners to apply for the appropriate expedited licenses, as well as to help. We know that this whole process is very different, even for our business community, and so the concierge service is intended to give that guidance, as well as to help to expedite the licensing process. Information on how that portal will operate will be available very soon. We will announce that. Houses of worship can open for gatherings of 10 people or less. Otherwise, they must maintain their online services, and we'll continue to give guidance as we move past phase one as to how we will operate there. Our farmers markets will be able to open for carry-out only, maintaining proper social distancing, mask wearing, and following CDC guidelines for cleaning high-usage surfaces. Child care facilities will be open for essential employees and for employees who are returning to work as a part of our modified phase one. In addition to the use of masks and gloves for all employees and having a social, again, all of the social distancing and other guidelines do still apply. Car washes may open with automated systems, but drivers and passengers must stay inside of the vehicle at all times. And so there are some things also that we have previously mentioned that will continue to remain in place and remain open. These include, but are not limited to, our parks, which along with the golf courses and tennis courts will remain open. I heard so much about these golf courses. People were very, very happy about the golf courses, but the tennis courts will remain open with appropriate social distancing measures in place. We believe for phase one, we will keep the basketball courts and playgrounds, however, will not be open at this point. Fitness facilities will remain closed as well. You must also continue to wear masks inside of all businesses, and businesses must continue to enforce social distancing. For our county government, our buildings will remain closed to the general public, and employees must continue to telework. But I do want to reiterate again to thank all of our employees, because the county government has remained open throughout this entire process and operational. This pandemic has also forced us to reassess the way that we operate government. And so what I can say is that there have been some really valuable takeaways from the COVID-19 experience about how to maximize efficiencies, and we will continue to provide the services and resources that our residents need and deserve. One that I've heard a lot about is bulky trash collections, because Prince Georgians have spring cleaned like nobody's business during COVID-19. And because of that excellent spring cleaning, they have wanted the return of the bulky trash collection service, and ours will be prepared. We're preparing to resume that on June 11th. So go ahead again this weekend and continue to spring clean, and we'll begin to make those appointments to come out and pick up those items. We have added virtual services also for a number of our agencies, and we'll continue to offer virtual services so that we can protect the health and well-being of our employees. We are also, for now, we're also offering additional testing for our essential workers, and those individuals can simply call our Chevrolet testing site, and they do not need to display symptoms to get a test. So for those who are even asymptomatic, beginning next week, you can contact our Chevrolet site at 301-883-6627, make an appointment, and go there to get a test. Regardless of the status of county businesses, again, we want you to know that we continue to work hard for you, and we are cautiously optimistic that as we prepare to enter phase one, that we will be able to continue to see the declines that are very important to us. Finally, I want to talk to you about our Prince George's Forward Task Force. We want to make sure that Prince George's County opens with the best support possible. We're looking forward. And again, what we believe about the coronavirus is that we lost a lot, and we believe that there's a lot also to gain. And so we're moving forward with a look toward improving as we go into the future, that when we stand up after the coronavirus, we believe that we're going to move forward in a way that is stronger than ever before. And so over the last few weeks, we have worked to create a task force that is capable of responding to the unique challenges that COVID-19 presents for our community as we reopen. And this task force, I have to tell you, is like no other. This is a dynamic group that can respond to challenges actually in real time and provide high-quality recommendations based on cutting-edge data. Moreover, this task force will help us to mend, heal, and protect our community should COVID-19 strike again. And so I'm proud to announce the Prince George's Forward Task Force. We have assembled a group of experts in public health, business, and government to create a nexus. The task force will combine new data with expertise to provide well-reasoned recommendations on how our county should deal with this pandemic going forward. The Prince George's Forward Task Force will generate a final report. However, we will implement the recommendations of the task force in real time. This way, we believe that we will be able to maximize the benefit to our residents. The task force will work on several broad recovery categories, including health recovery, education recovery, human and social services recovery, economic recovery, and government operations. We will work to recover from COVID-19 and to reimagine how our county approaches each of these areas. In the end, the goal is not to get back to where we were. The goal is to go faster and farther for our residents than we ever have before. And so thanks to the work of our directors, our chairs, and our internal teams, we already have a clear set of issues for the task force to consider. In many cases, we've gone a step further to create specific goals. For example, our business recovery strategy will include work to improve and ensure that small businesses have access to credit and financing. This is a huge issue for many of our businesses, and that is one of the areas we will work on. And so we realize, again, that that we have a lot of work to do, but I am so grateful for our task force co-chairs who are here today, Dr. Charlene Dukes and Mr. William Von Haney. You'll hear from them in a moment. In addition to our co-chairs, we've put together a group of experts for this committee. The chairs of our subcommittees include Thomas Graham, the founder of T.H. Graham and Associates, who will chair the Economic Development Subcommittee. Dr. Darrell Pines, who is president of the University of Maryland at College Park, will chair the Education Subcommittee. Dr. Joseph Wright, the interim president and CEO of the University of Maryland Capital Region Health, will chair the Health Subcommittee. Rosie Allen Herring, president and CEO of United Way of the National Capital Area, will chair the Human Services Subcommittee. And former Maryland Governor Martin O'Malley will serve as chair of our Government Operations Subcommittee. The task force will also work with several outside organizations on our county's recovery, to include the Maryland Transportation Institute as a part of the University of Maryland. We've chosen to partner with these organizations because they each bring a unique set of skills and information to the table. The Maryland Transportation Institute is a premier university think tank that offers access to an exciting transportation data platform that we know will be very helpful to us. With their partnership, the task force will have access to cutting-edge data that shows locations across Prince George's County that are at or near safe capacity. This location information will help us identify where we need to go to prevent new COVID clusters. In addition, MTI will provide us with daily statistics about the trends in mobility, social distancing, and other useful health variables. MTI will also provide the task force with valuable data visualizations of trips throughout the county, along with helpful statistics on visit trends to different categories of businesses. We'll be able to identify hotspots that are prone to new outbreaks, and we'll also identify patterns of interest so that we can respond to them in real time. The Prince George's Forward Task Force represents our best effort. We've assembled the right team, the right information, and the right advice to get our county back on track. And so I'm so proud of the task force. I want to thank them in advance for the work that they will do. Our county is moving forward into a new chapter, and the shape of this virus is well known, but so as well is the resilience of our county, and we are just excited in many ways to see where we go beyond COVID-19. We know that we are almost there. But to reopen safely, it just requires that we all continue to use good common sense. The common sense that will allow us to not only protect our own families, but that help us in our affirmative obligation that we have, not only to care for ourselves and our families, but to care how our neighbors fare and how our colleagues and others fare as well. And I believe that if we continue to adhere to the advice of the medical professionals, we're going to be able to take this next step and on and on and on. So again, I want to thank you all so much for what you've done as Prince Georgians, to your discipline and your sacrifices. Together, we're going to make it to the other side of the coronavirus, and I'm just really grateful for everyone who has helped us to get there. So right now, I would like to welcome Dr. Charlene Dukes to the podium for her remarks. I'm sorry, I didn't. Okay, actually, we'd like to hear from Dr. Carter. I wondered, I didn't see his name here, but Dr. Carter, would you come up, please, and offer your remarks?
Thank you, Madam County Executive. Good morning. Prince George's County has come a long way in the last 2 to 3 weeks. We've flattened and now reducing the curve, and we're happy about that, but I'm cautious. New coronavirus cases are going down. 3 weeks ago, we had a peak of 2,370 cases. Since then, it's declined to around 2,000 cases a week, and that's good news. Sadly, dozens of our fellow Prince Georgians have died from COVID each week, and as we continue to mourn their deaths, we can tell you we've seen an overall pattern of decline in deaths for 3 weeks. The county reached a peak of 74 deaths in the third week in April. Since then, we've seen a 16% decline. While we're still gathering reports from last week, we believe we will see a further reduction. We've seen a steady decrease in the number of COVID hospitalizations in the county. The average number of patients hospitalized due to COVID is now 181. That is a 26% reduction. We've exceeded our goal of having at least 30% of our hospital beds available for care. This is an important marker. It lets us know that we will continue to have the capacity to appropriately care for anyone with any condition in our hospitals for the foreseeable future. The health department and our hospitals have worked very hard to scale up bed capacity along with the state in the last 2 months. We now have 40% of our ICU beds available and over 55% of our general medical surgical beds available. However, we are keeping an eye on this. We meet every week, multiple times a week, and we're staying in close contact with our hospital systems because it's so important. Bed capacity continues to expand as they bring newly built spaces into operations. Now, testing. Testing is seeing a rapid improvement. More than 80,000 county residents were tested last week. We're still receiving testing data and hope that to receive them soon. With the opening of additional health department testing sites, we know we'll have the capacity to hit our testing goal as one of the metrics we are addressing for moving forward and loosening the restrictions in the county. Something else we took a very close look at is the positivity rate. 3 weeks ago, our positivity rate was more than 40%. It's now 20%. The shrinking positivity rate shows our testing capacity is casting a wider net. That gives us better information about how much of the virus is spreading in our county so we can make informed decisions about reopening and moving forward. And we keep a careful eye on this. The more residents we test, the better chance we have to contain the virus. That's where contact tracing comes in. We've trained dozens of county employees, contractors, and volunteers to be tracers. We have approximately 150 people doing the important work as of next week, and they're being trained, and they're coming online. Here's how tracing works. The health department is notified if a person tests positive for COVID. We call that person and ask where they have been recently. We make sure that we understand who they've come in contact with. We then notify those other contacts and tell them to self-quarantine for at least 2 weeks. That's to make sure it doesn't spread to others. That is why we're having appropriate numbers of contact traces. Having the appropriate numbers of contact traces is so important. The state has also stepped up, and they are supplying contact tracers for us, and a significant number. We do not disclose contacts who may have been exposed to a person who's positive for COVID-19 without the permission from that person. I want to be sure that everyone understands that contact tracers will not ask you for your social security number, payment information, or your immigration status. That's very important. This takes teamwork. If you get a call from us, take it seriously and take the right actions to keep everyone safe. Our supply of personal protection equipment is growing steadily, as the county executive has pointed out. We've worked hard to secure enough support to expand our testing operations and to make sure we have enough personal protection equipment for those hospital staff and for our staff members and other people who are working on the front line. Gathering enough PPE is going to be a critical operation for us, and we continue to fight to make sure we have enough. While we're still in the fight to help our residents right now, and we are prepared for another possible hospital surge just in case. Taken all together, this means we're seeing enough progress to gradually begin to reopen Prince George's County, and I mean gradual. We're not going to go too fast, and that's important to know. I am so grateful for our brave hospital and healthcare workers. I am so proud of the Prince Georgians who have made this very difficult life adjustment. But they've done it. You have done it, and you've done a great job. But the work's not over. We've got to stay strong in this fight. We don't want to backtrack, and we don't want to be forced to close up shop again. We must continue to stay 6 feet from each other in public. You still have to wear your face covering at the store and on public transportation. Keep a mask with you. Please continue to clean your hands often and stay at home as much as possible. We don't need an order to tell you this. You should know you need to stay at home as much as possible. Do not get complacent. Stay disciplined and stay safe. Thank you.
I want to thank you, County Executive Alsobrooks, for your steadfast leadership and commitment to Prince George's County. I want to thank Dr. Carter for your attention to the health needs of our community. The Prince George's Forward Task Force is the most critical undertaking of this administration, and I am honored to co-chair the task force that will assist our county executive in navigating the uncharted waters in which we find ourselves with COVID-19, a pandemic that is impacting each one of our families, our neighbors, and our friends in ways that we could never have imagined in the 21st century. A pandemic that is highlighting the systemic nature of our very existence, one that is ravaging communities of color and those who are low income. It illuminates the times in which we find ourselves. Each of the task force members, Co-Chair Von Haney and I, have a responsibility to be thoughtful, strategic, collaborative, and forward-thinking as we work with county government, listen to national, regional, and local experts, respond to community concerns, and be data-driven. We will offer insights, perspectives, and recommendations that speak to all of Prince George's County, north to south and east to west. We'll focus locally as we also think regionally. Because of your leadership, Madam County Executive, the membership is comprised of a broad array of individuals who represent a variety of sectors and understand collective thought, collective action, and collective impact. We'll begin our work, as you've noted, in a structure designed to focus on recovery in 5 key areas, each with a subcommittee chair. The Health Subcommittee, as has already been mentioned, will be chaired by Dr. Joseph Wright, Interim President, CEO of the University of Maryland Capital Region Health. The Education Subcommittee will be chaired by Dr. Darrell Pines, the incoming President of the University of Maryland College Park. Human and Social Services Subcommittee will be chaired by Ms. Rosie Allen Herring, the President and CEO of the United Way of the National Capital Area. Tom Graham of T.H. Graham and Associates will chair the Economic Recovery Subcommittee, and the Honorable Martin O'Malley, former governor of the state of Maryland, will chair the Government Operations Subcommittee. And each of them will be joined by an outstanding array of Prince Georgians and Marylanders who are committed to ensuring a thriving Prince George's County as we all look forward to a different normal. Make no mistake, we have heard the county executive loud and clear. This is a task force that must and will provide recommendations across a broad spectrum of public policy areas. We know our charge: to speed our recovery and to protect our community. Recommendations will be undergirded by one fact and all of its complexities. Post-COVID-19 will be different from pre-COVID-19. It is a somber time, it's a time that none of us would have predicted. We look forward to doing our part to change the trajectory of our community through the work of these 5 subcommittees as we race to discover new solutions and new opportunities. Thank you, County Executive Alsobrooks, for your trust in us. And now, please welcome Mr. William Von Haney, co-chair of the Prince George's Forward Task Force.
Good morning. Thank you, Charlene, and thank you, County Executive Alsobrooks, for including me on this important task force. I am Senior Executive Vice President and Chief Strategy Officer of Exelon Corporation, and I am honored to be here today and honored to join you in the task ahead. County Executive Alsobrooks, Dr. Carter, you, the entire county leadership, and your staffs have done a remarkable job over the past few months responding to this unprecedented crisis. Thank you so much for what you have done. I'd also like to recognize and thank our county's healthcare workers, first responders, and other providers of essential services for your commitment to one another and to this community. Two of our families of companies, Pepco and BGE, are proudly providing a vital service to Prince George's County. Energy that powers the life-sustaining work, keeps essential lights on in hospitals, grocery stores, and other essential institutions. We are committed to our customers in Prince George's County, and we are proud to be a major employer in the region. I've spent much of my career dealing with the complicated problems of modern businesses face. At the same time, I've had the opportunity to help guide non-for-profits, large and small. I've also dedicated a large portion of my work over my career to issues of diversity and inclusion, work that has helped strengthen small minority and women-owned businesses. I also chair the crisis management team for Exelon, which is addressing the challenges our company faces during this pandemic. I am hopeful that I will be able to bring to this task force some of the learnings that we have had at Exelon in dealing with these issues to provide safety for our employees, to provide safety for our customers, and to ensure that vital services are not only protected but enhanced as needed. As has been said by several of the speakers today, this task force is unique. It is one that must provide feedback and recommendations quickly across a broad spectrum of policy areas. We need to ensure that we rise to the county executive's challenge. We must recover from this pandemic, and we must be ready if the illness returns. This task force is also very well equipped for the challenges ahead. County Executive Alsobrooks has assembled a truly exceptional group, starting with Dr. Dukes. To have a deliberative body composed of our brightest leaders is a feat in and of itself. Thank you for doing that. It will be a pleasure to work with this group. To combine that leadership with the very cutting-edge data resources that the county executive alluded to will make this very powerful indeed. Strong leaders make strong decisions with good information. Today, we are starting an important process in our recovery. The Prince George's Forward Task Force mission is broad but very clear. We must help Prince George's County recover from this pandemic and strive to move the county well beyond where we were before this all began. I know that we can accomplish that goal. I commit as co-chair to ensure that we do everything possible to use our time and resources effectively, quickly, and successfully. In addition, I commit to using my expertise in business and not-for-profit work to help speed up our economic recovery more generally. By working together to get the right information, we can maximize the economic relief of major projects and programs at every level. We can create new career opportunities for Prince George's County residents. We can reignite and create new businesses. We can bring tourists here to visit. We can help to sustain real estate projects that are in the pipeline, as well as create new ones, and implement a mass transit program that connects residents with businesses and employees with their workplace. I know that through hard work, the identification and implementation of strategic and data-driven solutions, our task force will develop innovative, successful solutions for the problems that we face. The sooner we begin, the sooner we can make an impact in Prince George's County. Thank you again, County Executive Alsobrooks. It is a real honor for me and for Exelon to help in this very important task ahead.
Okay, and just briefly, before we take questions, I do want to mention that we have made an update to our county's dashboard earlier this week that also provides daily updates and weekly totals, so it's drilled down a little bit more specifically. Now, to that end, anybody have any questions?
You mentioned about how the county is recovering slowly. Carter's mentioned it. How do you calm the nerves of the people who still say, because the county is such a hot spot in the state, that it should slow down even more and not open it on June 1st?
You know, well, I appreciate the concern of our residents. They are very wise, and they have also been, they've taken this seriously. That's what we've urged them to do, and we encourage people to continue to do it. So if people still feel, the fact of the matter is, if they still feel that this is a dangerous time, they're right about it. And so I'm glad that they understand that, and they should know that we share that concern, and that we have taken a very cautious approach, which is why we're doing a very incremental phase 1 opening. We're behind much of the state because we recognize that Prince George's County's concerns are unique to Prince George's County. And we're not taking any chances with the lives of our residents. And so I'm heartened to hear that our residents still do take this very seriously, and they do. They are not kidding, and you know what? And they should. But they should know that, again, as you've heard even from our co-chair, Bill Bonhaney, I love what he said when he said that good leaders really make good decisions based on good information. We'll make sure that the decisions we make are based on good information, health information, science, and scientific information, and that's what they should know.
Let me ask you this. I asked the governor the same thing when he first announced his steps a couple of weeks ago. You have the data, you have the numbers, you also have your emotions. Was it a hard decision for you? Do you feel really confident now going forward with this phased in?
I do. I feel very comfortable that we are ready for phase 1. We set out the criteria that we would use, including those metrics about hospitalizations, and you've heard that the infection rate has declined. You've heard that we have now hospital capacity to care for those should we see an increase in numbers. As we test more and more, we expect to find the numbers will increase. And so we want to make sure that as that is the case, we're able to accommodate people. And so I feel very comfortable that we are making a good decision in opening the way that we are.
And then, since we're an impatient species, next week the governor said if the trends continue, he might go ahead and go with stage 2. You gonna take it that day and make another decision, or do you feel like you're going to have to be in this phase for 2-3 weeks?
So what we'll do is to continue to look at the numbers as they relate to Prince Georgians, and we'll make the decisions that are best for Prince George's County. The governor is making decisions for the state, and he recognizes and appreciates that we are very uniquely situated because of our geographic location to Washington, D.C., for example. So we are coordinating with the District of Columbia. We've coordinated with Montgomery County. We share some of those borders. And so that's the information that we'll continue to monitor. And we'll make decisions based, again, on science and medicine. And we'll also confer with our neighbors and make decisions that are best for us.
And one more question from Ms. Tracy Wilkins, who asks, unemployment claims, been a struggle statewide. Do you have any information about the impact that difficulty in filing claims has had on Prince Georgeans, and has there been any discussion with the governor about that particular subject?
And so this is a struggle that we share statewide. We have unfortunately had over 80,000 Prince Georgians who have had a need to file for unemployment, and they are experiencing the same stresses and strains as the rest of the state. This new system was difficult to navigate because of the volume. And so we are working as best we can to assist all of those who are experiencing such a time of uncertainty and fear and devastation. But we're no different than the rest of the state as it relates to trying to access that system. I know the state is working to try to improve it, and but it's just a difficult time, and we're experiencing the same challenges in terms of accessing that unemployment. I've been hearing a lot of concerns about it. And so we're just hopeful that it will be repaired and can help people more quickly because they need it.
County Executive, the governor yesterday was talking
Donna, can you come up for a moment? We have an expert, and none better, so we want to have her to address this question. Thank you.
So there's no, oh, I'm sorry. Sure, Donna Perkins, and I'm the epidemiologist with the health department here in Prince George's County. This is such an unprecedented situation where there are massive amounts of data coming in about cases, about possible cases, possible related deaths, and really what we're all doing is the best we can to coordinate that information. The state has reports that come to them. We actually have reports that come directly to the county. So what my team does is we work very diligently to reconcile those reports, and we have a constant feedback loop happening with the state, so they update their list, we update our list. And so when you see slight differences in the numbers, it's simply just the nature of what we're dealing with. Where we're dealing with such large numbers of reports, we want to make sure we're giving just the best information possible, the most accurate information about the health and wellness of our residents. So we're simply in that constant process of making sure that that data is being updated as quickly as possible, and have worked very closely with our state partners to ensure that that happens.
Dr. Carter, I'm really sorry to hear about your mom. Can you talk about, the work that you're doing is just so vital right now, and yet you are also someone who has just had to struggle with this. Can you just talk about what's going on right now? How is working and also dealing with those, family matters that, are also very important?
Well, this is important work. I mean, and just to say, my mom basically had 3 tenets for me. One of them was to make sure that I helped other people. That was our first tenet. The other tenet was not to start something that you're not going to finish. So those things that's why I'm standing here right now, because she passed that to me. And so this work is exquisitely important, I mean, in terms of what we're doing. You just met Donna Perkins, who basically spends 15 hours a day, if not more, making sure that our data is correct, because we don't want to come to the stage and say something we're not really sure about. Like, for instance, the positivity test rate. We've been monitoring the positivity test rate since we started this entire project, because we know that it's an important variable to know about in terms of how well we're doing with testing. Now, my mother would have wanted me to come here and tell everybody that we're monitoring that rate. You understand what I mean? So that's and the last thing I told you was 3 things. The other thing is that keep your mind open for learning. And that was the 3 things my mother had as her pillars. So what I'm saying is that that's what we all have to do in Prince George's County. We have to keep our mind open for learning. So when we say something like positive test rate, look it up. Make sure we're saying the right thing to you. When we say you need to social distance, we didn't come up with that out of the clear blue sky. This is something that's important to do to stop the spread. So you have to keep your mind open for learning. You have to continue to do what you do, and you can't stop. And you've got to help other people. So when you wear a mask, you're helping the other person. And that means the other person should be wearing a mask helping you. So all of the things we are saying, washing your hands, wear the mask, social distance, when we start talking about reopening, we're going to be having strict guidelines about what businesses should do. And if we say, okay, you can't open X, that's because we feel that at this time it's not ready. Based on the science, based on how we do work, that's what my mother taught me. So that's what it is.
I just have one more question. I got a phone call going to basketball. A lot of basketball courts, a lot of the rims have been taken
yes.
down. I went and drove by just to see if this person was at. Well, there's some up at Kings Grant in Upper Marlboro.
Yes.
And I was told there was some young men playing. No, I know obviously you want to have police arresting or put people away for just playing basketball. But what message can you give for young people who are just anxious enough, wanting to go play, and you tell them this is not the right time to do it?
Yeah, so you know what, this is not a time that enforcement is, we're not heavy-handed in terms of enforcing. What we say to our young people is to follow the rules so that we can not only, this is not necessarily, young people are surviving COVID-19, although some are very sick from it. But this is also, to Dr. Carter's point about helping other people, this is about saving your mother, father, and grandparents' lives as well. And so this is a time where, as a community, there are certain rules that we have put in place so that we survive as a community. And so our kids will certainly understand those. And you know what? And as we find that people have forgotten or are anxious to move ahead before the rest of us, we're reminding them. We're educating people. We're asking them to comply. The Department of Parks and Recreation has helped us in terms of shutting down most of those courts and such until it's safe to use them. And I think everyone understands. And for the most part, you know, people have been absolutely beautiful in terms of complying. All of us want to be safe. And I find that people more often than not are really following the guidelines that we've set out.
What do you all think the most important statistic is? Right, so, I mean, we talk about a whole bunch of different things, and right, Governor this morning talking about positivity rate going down. Is it hospitalization?
I'll let Dr. Carter answer which one he thinks
I mean,
is.
it's the best indication of how many people are actually really sick.
The best indication of how many people are really sick?
No, no, what's the most important stat to you?
It's a combination. It has to be a combination. It has to be, as we said, the decline in the test rates, that in case rates. Of course, that is a reflection of the infectivity rate. So we're looking at how the virus is spreading. We got to make sure it's slowing down. We have to have adequate testing. But also, you have to be sure that the hospital capacity is adequate for if you surge. And looking at hospitalization decline is part of understanding about the infectivity rate. So we look at a combination of things. You can't look at one thing. You have to look at multiple things. Thank you.
All right, no more questions? Then thank you all for coming.